pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Good morning, Marty.
Good morning.
We have the agenda ahead of us this morning. Is there any additions, deletions, or corrections?
I don't have anything.
I'll make a motion to approve the agenda as presented.
I'll second that motion.
Okay, we got a motion and a second to approve the agenda. Any other discussion? None. We'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries. With that, we have the minutes of last Monday's meeting. Is there any additions or corrections to that?
I thought they read very well. If there's no objections, I'll move to approve the minutes as presented.
I'll second that.
Got a motion and a second on the minutes. Any other discussion? If there is none, call for the vote. All in favor, say aye.
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 All opposed, same sign. Motion carried. Okay, first item of business on the agenda today is the ambulance part-time wage discussion. Pat?
Sorry about that. We'd have made you feel welcome if we thought I
I
put
didn't
the
even
chair
realize there
there.
wasn't a chair next to me. It's right there.
Good morning, Pat.
Morning, Pat. I think
Everybody got one? We got them in our packet, yep. If you had a chance to read it, the situation we're having right now is we can't get paramedics to come work for us because we're working for the surrounding areas because they're paying quite a bit more money. We're paying some of our overtime now is being worked by the full-time medics, which their wage at overtime is about $11 more than what I'm proposing for the part-timers. It's running our overtime budget higher than where it should be right now. And the full-time people are getting kind of exhausted on the hours too. We've got one paramedic that's working part-time on a regular basis, and we're paying him overtime because we don't have anybody else to fill in. My proposal is to bring the part-time up to the same wage as the full-time with the, minus benefits. And I'm hoping that I've got about 2 and maybe 3 paramedics that'll come work for us if we get the wage up there.
You don't know, do you know that for sure, or are you assuming that?
Pretty good indication. But right now, they can go to any of the surrounding counties and make anywhere from $2 to $6 an hour more.
Okay. As the manager, you have the ability to determine who's going to work, whether it be an overtime or a part-time person in order. And the question I was going to ask you, and we talked about this earlier, is a year from now, will you be able to show us whether or not this actually saved us money? Because sometimes people want to work overtime, and they say, oh, get a part-time here, that type of thing, but you're the manager and you control it. So
I control the schedule, yes.
If this works, if this is approved and it works and you get the people hired like you're thinking, are you going to report to us a year from now how well it worked or didn't work or whatever?
I sure can.
And is it your feeling that this will save us money and provide better service?
I truly think it'll save money for the fact that we'll keep the full-timers from working as much overtime. I mean, they'll still get their overtime from calls and such, but my hope is that we have enough part-timers that they don't have to work full shifts where they're getting 36 hours of overtime.
Yeah, that was part of because you showed this statistic where we're 25% through the year and 37% through the overtime, but some of that is not preventable. Like
True.
if they're on a run, and then
True.
it just gets stretched out. You can't say, hey, we're going to
Right.
fly a part-time over. You just can't do that.
No.
So I can't see in this how that is divided up. You're going to have to help me on that one.
Usually on the overtime, we stay just below budget. The full-time overtime, we're usually just a little bit below budget through the year. Right now, we're a little bit over. And I attribute that to the fact that there are a lot of full-time medics working the extra shifts. And that, it causes 2 problems. If they take comp time, well, now they got more time they got to take off. And then you have to have somebody fill that. It becomes a very vicious cycle when the full-time people work the extra shifts.
I guess just in the past, the biggest issue here is just the overtime. And it's kind of a unique situation because you've got on-call and then you've got,
Right.
and then you're on-call and then you've got the actual time.
Mhm.
So it's kind of a unique situation and taking that all into play. And
I put a lot of time into this and thought about this a lot. I've been thinking about it for about the last year, and I really believe that this will lower our overtime on the full-timers.
I had reported this following our October board meeting. Marty was there, and I thought, Pat did a good job. Most of this information is about the same. I had asked Pat to get a couple more comps in there, which looks like he's gotten at least one of those. And my concerns with this belie the same as they did that night. And Neil kind of just stole my questions. Is what I'm a data guy, I'm a data guy, and I prefer to see some analytics go into it as far as what we're paying. What are we paying in overtime right now? How many hours of overtime for? You want to go year to date or go fiscal year? I don't care, but I'd like to know where we're at today, okay, and what you project for this thing to save, and then when we come back around next year, we're going to find out, see how close to that we came. Does that make sense?
Yeah, but I don't know if you can project that without knowing, if I knew how many calls we were gonna have.
Based on today's calls, you'd have to. You'd have to do it. Again, data doesn't lie. You just have to go on what's known. You couldn't project. It's just no different than when we amend a budget. We can't project, things that are going to enter into it.
So compare, say, the last 12 months to the next 12 months?
Yeah, or at least from a start point. I don't care if you went 12 months or if you went beginning of the fiscal year or if you went beginning of the calendar year. But I, for one, would like to see projections on what, we expect this thing to do. Fundamentally, Pat, I don't have a problem with this. We're talking, well, we've got 1 or 2 paramedics now. I think your outline here says we've got 2. We've really got 1 for sure and maybe a second, if I understood October right. And then, as he just mentioned to Gene, and I think it's in here too, we're talking perhaps 2 to 3. This thing's not going to be a global negative fiscal impact on the service whatsoever. So fundamentally, I do not have issue with this. I have a little bit of an issue with the timing of it, particularly when you say that you've been thinking about it for a year. It's perhaps something we might have been wiser to build into our budget. And so we don't have to do any kind of amendment for it at all. But if overtime continues on the way it has, we're going to have to amend anyway.
Right, and that's what brought it to my attention, brought it to the front of the situation now.
Right.
It's because of the amount of overtime we've had recently.
Do you have any idea what we've paid out in hours in overtime, say fiscal year to date?
No, I don't.
Okay.
You see, that information would be important to me
Really
too,
important.
because
Yeah, I was thinking the same thing.
when Mark was talking about this, it really back to thought I had, where you're doing this percentage thing, we're at 25%, where overtime's at 37%. But I don't know how many hours you've predicted in your thing. If you predicted 1 hour of overtime all year and we're 37% over that, I don't care.
Right.
But if it's a different, that percentage is only meaningful when it attaches to dollar amount,
Okay,
to me.
makes sense.
So I'd like to see the dollar amounts, and then it would be much more meaningful to me, Pat.
Okay.
One other thing I raised that night is, and this doesn't make a deal maker or breaker for me, but I would really like to have, where are we at with the union? I had asked for a letter or a statement or something from them that they were in support of this, because we're already in second year of a 3-year deal with them. I don't want this thing to come back at the end of this collective and they say, well, now, your part-timers are making what our full-timers are made, and we got a problem with that. I'd like to have some language documented so that when we go into collective bargaining with them again, that this won't arise, and it most certainly will unless we have their buy-in.
Well, I don't know if, I don't know if I can get anything in writing from them. I've talked to all of them, and they're the ones that brought it up to get more part-timers, to get the wages up, so they don't have to work so many hours. Okay.
Do you mind if I talk to one of
No,
them?
that's fine.
If you don't mind.
I think that's a sharp, good idea, Mark.
And I think I do want it in writing, Patrick. Why wouldn't they give it in writing if they're all agreeing to it?
I don't know if they would or not. I've
Okay.
spoke to them all individually. but-
Yeah, the current union steward could move on, go elsewhere, and then, well, then that was his word, and then we got to start all over again. So,
I didn't know the boundaries of what I can talk to them about on this or not.
yeah, well, I'll be glad to make the call if
Okay.
that's all right.
Yeah.
And before we make a decision on it, I'd like to have that in hand.
And I don't want to sound overly critical. I like where you're going with this, Patrick. I think you're on the right track. I'd just like some solid hours or something,
Okay.
so I can definitively support it.
And see what it does over the next year.
Absolutely,
Yeah.
absolutely.
Makes sense.
Does that sound reasonable?
Yes.
I would agree with Neil and Mark on this, if we had some more numbers to look at.
Okay.
It'd be a lot easier decision to make.
Okay. I'll see what I can get put together and bring it to you next week.
Yes.
That work?
Yeah, that'd be good.
Okay.
Sounds good.
Sounds good.
I think we need them hours to document our decision,
Mhm.
Yeah,
verify it, so. Because I agree, I think too, it's a good idea that
Yep.
what you're trying to do here.
I'll have to do that and see if we can get some numbers together.
Anything that stems that overtime, Pat,
I know.
I'm
Yeah.
real comfortable
Well, and
with it,
the workers think that too, because they're getting tired of working all the hours.
Yeah, they're getting.
Well, I can see that,
Mhm.
especially some of the hours they put in, that's,
Is there anything else we want besides union statement and hours, so we have a clear sense of direction?
Hours and a little bit of a projection. I would want some type of forecast and projection of what you would hope to accomplish. So, two of those are very closely related, and I'll visit with the union steward if I can reach him this week and get some kind of understanding from it. And this is only going to affect the paramedics
Right.
only. We're not doing
Right.
anything with the EMTs. And are we expected to perhaps do that? Will that come next?
yeah, that's what.
it's a good point.
If you look at you've got some of these on here, they're not real far off of what the other ones that I have listed.
Mhm.
Maybe $1 an hour, but not 3 to 6 like the paramedics are.
Okay.
Virginia, you have a comment?
I've got two questions. As a director, do you take a shift as such?
I do, yeah. And that doesn't cost county anything.
Okay, and the second question is, what is the reimbursement rate for insurance and Medicare? You don't get 100%?
No.
Oh, no.
No. It averages somewhere around, what do we figure? Less than 50%.
Yeah, it's like 36%
Yeah.
last I knew
Yeah.
what it was.
36%?
That last I knew it was. I haven't looked at them for a while, but. And then remember, that's just Medicare, Medicaid. Your major insurance companies follow what they do.
Mhm.
So
And the county picks up the rest?
Right.
we write off the rest. It's,
Well,
we write off the
it's
rest.
part of the budget.
Do you have any questions for us?
That's it.
Are we pretty clear here?
I think so. If I have any questions, I'll email somebody and,
All right.
yeah. Okay?
Fair enough.
Thank you.
Thanks, Pat.
Thanks, Pat.
Have a good week.
You too.
Okay, with that, we'll go down to the second item on the agenda, is the case management MCO discussion. Justin and Angela?
Well, what happened this week?
A lot's changed.
I think it's
Question is, what's
it's
gonna
going to
happen
be
next?
easier just to go
what's
through
happening
each
right now.
four,
Yeah.
each one of them, and just kind of tell you where they're at right now. That's probably the biggest thing. Angela and I went to an administrators meeting last Tuesday, and all four MCOs were there. And this was a meeting strictly about case management. So we were able to have a pretty decent discussion with all four of them, and they answered a lot of questions. So we kind of have more of a clear vision of what they're planning to do with case management. So I'm going to go over the first two, which are going to just use us as a 6-month transition. So AmeriGroup and United Health plan to be able to continue using us for 6 months. After that 6-month period, then they would do case management themselves.
AmeriGroup and?
AmeriGroup and United Health.
United.
Yep. So they would assign a case manager right away, and they'd be working with us during that 6-month transition period. The way that they're going to handle that 6-month transition period is different, though. AmeriGroup doesn't want us to sign a contract for that 6 months, which is very interesting because we really have no, like, in writing guarantee that they're going to pay us. Now, they've said they'll pay us, but, you know, I mean, there's nothing that would really legally be bound for them to pay us. So,
And I did ask specifically to them if they would entertain some type of a contract, because our county attorney and county board of supervisors are not going to want us to continue to do business if we don't have some form of in writing reimbursement. And they said that they would get back to us on that.
but as of right now, on November 2nd, and things start on January 1st, we don't have anything from them.
And that's AmeriGroup has no contract.
AmeriGroup, they said as of this point, they would still pay us by the claims that come in, but they don't want us to sign a contract right now. That's.
And paying us at
current
current
state.
rates, if I understood it.
Yes, but there's no legal guarantee, there's nothing in writing that says that that's gonna happen.
Was there any, I'm sorry.
No, go ahead.
I was just gonna ask if there was any, is there any billing process set up?
All four of them will take paper claims or electronic claims. They all take the same standard form.
Okay. And they'll pay monthly?
Yes. Yeah, they pay within 30 days.
Sorry.
No, that's okay. During the morning session, there was actually a representative there from Iowa Medicaid, and she explained that all four of the managed care companies have to offer a contract for those 6 months. And so when AmeriGroup said that they were not going to have a contract, they actually may have to change that standard or that requirement.
But we're really going to cut it close because we don't even have a
So
contract to look
just-
at. Or,
They're just doing what they have to then.
Correct.
so, I mean, we're kind of leery about providing services without any agreement. I don't, I mean, are you guys thinking the same thing?
I
or-
don't think we need volunteer services.
Yeah, we concerned what some of these contracts say, and then when we have nothing
Right.
in writing, we
When
can.
particularly some of these don't have the best reputation to start with.
So the good thing is, I guess, from the client response, as they kind of review the different provider networks for the different companies, is they really want to keep their same providers and case management agencies that they have now, which would mean that, they would probably look at other options if they wanted to do that other than AmeriGroup and United. So,
Okay. Now, can they let us say that you're providing case management for someone, and they want to keep you, and you got to get a contract with Caritas, but are the people they need to see also contracted with them, so that'll work out for the whole flow of things? Or is there a specialist with somebody else that's not contracting with you?
we don't know yet.
You don't know yet? Okay.
From the ones that we had contacted, they plan to work with all four, but we didn't get information back from everybody.
That's the problem, and we've discussed this
Yeah.
before. It's no big news or anything that even people who want to go with you may have to go with somebody else because the specialist they
Correct.
need is not with who you are with.
The good thing, I think, is with the main providers, the doctors' offices, the hospitals and stuff, if they want to keep all of their current Medicaid clients, they would almost have to work with all four of the agencies, so.
So this concern probably won't develop to a large-scale problem.
I hope not. I hope not.
Well, I hope not too, I just.
Yeah, I mean, we can't really, it's impossible to say.
Yeah.
I mean, we would know
Right.
more in a month or
Just-
two, once contracts are already signed and stuff, but as of right now, we wouldn't be able to say with 100% positive. So that's where AmeriGroup is. United, like I say, they will use us for a 6-month transition, and they would like us to sign a contract. We just got that on Friday, so haven't had a time to really do anything with it. Once again, if things go, like we think they might with clients wanting to keep all of the current service providers, we may not expect a lot of people with United. So again, we can certainly do the contract and stuff. It's just that we may or may not have a lot of clients with them, and it would only be for 6 months, so. It's kind of one of those things that it's not a big deal to fill out all the paperwork and get it in. It's just, I just want to make sure that it's worth it to,
Follow through.
Right, to follow through and work on those.
I want to back up to this no contract entity. If it's in their contract with the state that they have to pay for 6 months, they're kind of under a contractual agreement to pay you even if you don't have a contract for 6 months.
Is it in there? Is it in there? I don't know.
Because they're probably doing it
specifically-
because they have to.
They have
for
to.
6 months.
Yeah, they're required to offer a 6-month transition.
So with their original contract, they may already be locked into that. And that would be something I would like to know.
Uh-huh.
Because maybe, I'm thinking, oh, we can't do any other contract, but they may have a contractual agreement with the state that requires them to do that 6 months where they're gonna have to pay if you do everything
Mhm.
correctly.
Honestly, I think we'll probably see a contract come through from AmeriGroup.
Yeah.
It's just, do
According-
we have enough time to
Correct.
process it?
Correct.
Yeah.
Okay, maybe I'm jumping to conclusions here, but just things we need to keep an eye on
Mhm.
anyway.
Okay. And then with United, do you want me to go ahead and follow through with all of the contract and credentialing with that then?
I think you'd have to
By all means.
eventually.
I just wanted to make
Yeah.
sure, because
Yeah.
we might not expect to have a lot of clients on there, and it'd be
Yeah.
just for 6 months, so we can work on that.
It seems to me that a couple of counties, Cherokee maybe for one, and is not gonna do the credentialing or anything. Is that how, the reason I'm asking this is, what's your possibility of getting some nearby or contiguous counties
Well,
clients?
I think it's certainly a possibility. There's DHS in a lot of the surrounding counties, and, they can't keep everybody because they're getting inundated with clients right now from other areas that are already losing case management. So you have some outlier case management agencies. Woodbury, for example, is one that has lost a ton of case managers, and so they refer all their people to DHS, because DHS is kind of the catch-all, and so they can only handle so many cases too. And, we could possibly get some from DHS if they get overloaded. If there are county case management agencies in our general area that close their doors, then there's a good chance that we get some of those clients, at least the ones that are with the MCOs that we contract with, so.
This is an interesting conversation. We're worried about keeping our clients, and now we're using concern of overloaded. So.
Well, DHS could get, I don't know that we'll get overloaded,
Yeah.
but DHS might.
And what will your geographical objective be? Carroll and contiguous counties, or?
And that's kind
I
of-
mentioned Cherokee, but that's a little ways out there.
Yeah, that's kind of what we said, that right away, Carroll and all the counties around us, and that, we could work with something else if we had to.
Okay. You go ahead.
So we'll work on that then and get that out. So the other two, AmeriHealth and WellCare, both want to use us for the long term. So that's past that 6-month transition period. And we already knew that from AmeriHealth. WellCare, that was something that was kind of new to us as of last week. So that was good news from the week. So with AmeriHealth, the one thing we were waiting on was the provider manual. So we were able to get that and review it, and we didn't really see anything that we couldn't do or adjust to. So it seems like a pretty standard, a lot of the same stuff that IME required of us, with some of the extra stuff that AmeriHealth does as well. So I if you guys had a chance to review that at all, did you have any questions on the AmeriHealth Provider Manual?
And this certainly isn't all of it, this is just kind of the highlights of it.
The Provider Manual?
Right.
This
Yeah,
is
yeah.
the final draft, as of right now, that is the Provider Manual.
Okay.
So there shouldn't be anything left out. They had talked about, they were in a very big rush to get these done, so they're probably gonna, revise them sometime in the future, just to clean them up a bit, but that is the final draft as of right now.
There was a lot of stuff in this 38 pages, and the first thing that stood out, two things. One was the compensation is based on attachment C, which is blank again.
So is that for the AmeriHealth one, or is that for the WellCare?
This is the WellCare one.
That's the WellCare.
That's the agreement.
That's the only one I printed out. Printed out hard copy.
Oh, okay.
So that agreement, it says you're gonna get reimbursed according to attachment C, the compensation attachment, and that is a blank page.
And as far as that goes, we have an informational letter here from IME that specifically discusses what our reimbursements will be as of January 1st. And it says specifically for case management that we will be reimbursed at the rate that we had as of July 1st of 2015.
So
that's
that'll be
our current
attachment
rate.
to Schedule C there.
We could certainly,
Is that what you're
Okay.
looking for? We just need to know.
We have another attachment, but I don't think that was it. Not a B1, okay. No, I didn't see that. Is that the attachment? Is that ours? Okay,
I think
okay,
that's
so you
the
have that.
attachment. Yeah, I think that's the
Okay,
attachment.
well, I'm
they're
not gonna
referencing.
read this over now, but you do have
Yeah.
rates.
yeah, we do have rates
Okay.
that are set by
All right, well,
IME.
then that
And
concern is not
those
valid.
rates are, you said as of,
July 1st of 15, so that's our current rate,
so
what we're
that's,
billing
that's,
now.
that's good.
Yeah, and.
That's still 15 minutes.
Yes, still 15-minute increments, nothing with that will change, at least, in July. It may change, but up until July, it's gonna stay the 15-minute increment at our current rate. And the managed care companies all said that they did not plan to cost settle. So I guess what that means for us is if they don't cost settle, we still bill our rate. And with the units that we have so far, projecting that out through the course of the year, we would have enough to cover the entire cost of the program and then some. So that's what it's projecting out to be right now. Of course, that's with our current caseload, and we don't know exactly where that's gonna go, but there's some leeway there.
Yeah, you have no way of knowing who's gonna fall in which group yet, do you?
No.
So you don't have any idea the number of case
Uh-huh.
cases you'll have?
All I can say is that as far as the clients that we've talked to, they all are very interested in keeping all of their current providers, including case management. So they'd be very interested in doing that as long as it works out with all the rest of
As
their.
long as they bring it up to you, you can discuss it, right?
We've just been discussing very brief facts with them and just giving them some information.
But I mean,
And-
you can't go out to one of your clients and say, hey, we want you to
No,
sign.
No, we
no, we
cannot.
can't.
That part I highlighted here, Gene, I had that same concern, and 9.5, it says no steering,
Right.
Mhm.
and that addresses that. And it basically says, if you sign this contract with us, we don't want you to steer people to another entity. So we talked about that when Mark and I met with you, and
Mhm.
you can certainly tell them all the facts you want, but they have to make that decision.
Exactly, and that's what we've told them.
So-
We've told them, and also in these contracts, it says that they have no problem with us letting them know what networks we're in. And so that's okay too.
Okay.
And you could say to them, well, these other, if you want to continue with us as your case manager, you have to go to one of these, do that, right?
We kind of explain the process. If you go with these two,
Can't say it like that.
no.
I mean, yeah, but you gotta
We just say.
get the wording down, right?
Yeah, so with each of the four, we can just explain what their case management will look like with each one. With the AmeriGroup, they're gonna be assigned a case manager from AmeriGroup that's gonna work with them after the 6 months. With AmeriHealth, they're gonna have us continue as their case manager. With WellCare, they'll have us continue as their case manager.
That's what I was
Yeah,
getting at.
Mhm.
so, but we only give them facts, and then they can make the decision based on what's important to them.
Well, and if they're satisfied, which your surveys show, you shouldn't have an issue there.
Right, and our clients and guardians and stuff, they don't like change. And so, you know, anything to alleviate change is something they'll be interested in.
And those particular type people are consistent type people.
Mhm.
Yeah, and as with the other one, they say this agreement is not a standalone agreement. It incorporates all this other stuff, including the provider manuals.
Mhm.
That's something you've got from this entity as well?
Yep, we reviewed both provider
So
manuals.
you got two provider manuals?
Yep, and they're very similar, and there's nothing that we have concerns with.
Yeah.
There's a few things that we might have to make some small adjustments about, like what we talk with our clients about, but nothing that's a real concern or anything.
And on the good side, it doesn't include Schedule C1, which you showed me, which we did not have here.
Yep, so yeah, the rates are all set up and ready to go.
What concerns do you guys have after you've read this one here, the WellCare health plan? Is there anything we need to be alerted to?
I don't think that, there was nothing in there that jumped out at me that we couldn't do or anything. It's similar to the AmeriHealth. I think they all had kind of a basic things that they had to touch on. So it's just a very general provider agreement that just goes out to all of their different agencies. So it's kind of difficult at times, you know, sorting through it to see what applies to us. But the stuff that did, it's similar to what IME has always had us do. So.
Okay. No, I learned a lot. Now I know what a clean claim is for.
Yeah, exactly.
Before I read this.
The one thing with the billing is we'll have to find what the best way to do that. If you use electronic, they use clearinghouses, and sometimes the clearinghouses cost money for the different claims that go through there. So we'll have to look at that based on how much that would cost, time involved. When you bill electronic, there's not really much of any time involved. If we use the paper claims, then we can send them right to the agency, and but that would be a little more time on our end. So we'll just have to see how that works out.
And I think you said we can bill through our current system.
We could still use CSN to get things ready, but unfortunately, it would still have to go through another clearinghouse. And the other clearinghouse is the one that would possibly cost money.
Do we need software?
We wouldn't need any software. It's just basically sending the information to a big place that processes it for the MCO.
So their forms are something like web-based on their site, so you just access them on there?
Their paper forms are just a standard form.
Okay.
They all use the same one, so that wouldn't be a problem.
I can't put my finger on it, but I was reading here something about contractors and subcontractors and all that, and I got to thinking where you are actually a sub-entity of Carroll County per se, and how does that all work? Authority to sign these different agreements?
That's a good question. I've never signed anything yet, so
Because,
that's
they're
what we
gonna want
want.
somebody to sign this agreement, and
Mhm.
your case management is sort of like a subcontractor to the Carroll County per se, and I'm not sure what they're gonna want or what we have to offer for authority to enter in these agreements.
Right, and that's
And
why.
that's something that I think our county attorney should address. I'm not capable, I don't want to answer that question myself. I just want-
Right, I think what we've always done in the past is the chairman would sign off on like the cost reports and things like that, because the county is responsible for the case management program. We might manage it, but you guys are in charge of it. And so while we're kind of a subcontractor, I don't know that they see us as probably one entity, but we could certainly check that out. I guess my plan was to have the chairman sign off on all the paperwork, because you guys would have to approve that anyway.
That makes sense to me. I
Well, I think.
think you should run it by John.
Yeah, all those contracts, John should review first, I think.
Right, and he's got the WellCare contract now.
When do they want this back?
ASAP.
Yeah, no, there's not a firm date that,
They don't have a firm date, we just want to get it back as
Sure.
soon as we can.
I think, okay.
Because right now they're gonna get flooded with them, now that the provider manual and the rates and stuff are all set. They're gonna get a ton of them at once, and so we need to make sure everything's in there and processed before
Right.
January 1st for sure, but, you know, be nice to,
Yeah, and I could see where it would take an attorney a little while to go through this, because they're gonna pick up on some legal stuff that I just didn't quite catch when I
Yeah.
went through, because I'm not an attorney,
and
obviously.
he said about 2 weeks to really review a contract, is what it would take, so.
When do you expect the United Health to come with their contract?
We just got it on Friday.
Oh, you did get it on
Just get it
Friday.
on Friday, so we'll have to get that out and look at it and get it to the county attorney and then bring it up here again. So we can start working on that this week.
I appreciate how you guys are staying on top of all this, because there's a lot going on right now.
I have one other question. Do you think, you say United Health plans on using us for 6 months.
Right.
Do you think there's a chance that they may switch that over to use you beyond that point?
Well, they had talked about if there's a pocket
In the state.
in the state where they can't find their own case managers, that they would use the existing agencies there. So there's a possibility they were talking about rural Iowa there. I don't know if we fall into rural Iowa or not, if you want to consider that. But yeah, if there's pockets, then they said that they would have to, because they have to cover the entire state.
See, and I think
The Amerigroup said they definitely don't
They have no
want.
plans of using us.
No, AmeriGroup actually plans on combining their LTSS, which is the long-term support, the waiver population, all in one, and they're looking at caseloads between 90 to 120
They're kind of doing things like the IHHs.
Per case manager?
per case manager.
Holy crap. I mean,
That's what they announced last week.
I want to see how long that's going to last.
yeah.
I mean, realistically, do you see your clients once every 3 months, 4 times a year?
Well, some of the waiver recipients, or the rules, they don't require that frequent. It's just the intellectual disability and BI waiver requirements are that frequent. But with the other, like the health and disability waiver, they don't have to see them that often. But still, that's a very high caseload.
Most of the time, we were always talking around 30 to 35 per caseload is a good caseload.
Yeah.
And we did get confirmation at that meeting that the other, AmeriGroup, they're gonna do their thing, but the other 3 are gonna let us stay at our caseloads. They're not gonna raise them or put a basement on how many that we have to do. They're just gonna stay with what's written in law right now.
Yeah, all 3 of the other ones said that they will follow Iowa law.
Which would be, there's no bottom number, and then there's a max of 45. So they'll keep that where it's at.
I wonder if that'll come out at those public meetings, that their caseload could be as much as 90.
I doubt it.
In both of these agreements, they basically say that, for example, health plan, they can't dictate a lot of things. If they need a health care, they can't say, no, you can't give that
Right.
to him. And that's in both of them. But overall, do you have any feeling whether these companies are gonna try to streamline things, or do you think they're gonna add more on to your job responsibility as case managers?
I don't know that they're gonna add on. I think they're gonna be more involved, at least from what they had said at the meetings, that they would be a little more involved with clients. Because they'll have, while they might use us for the long term, they'll have their, they still kind of call them case managers. We're community-based case managers, and they have like a case manager that they have themselves on their end that has high caseloads, and they might check in with us if they see somebody that's using, that we've seen a lot, and say, hey, what's going on?
Or they've had frequent trips to the emergency room.
Yeah, so it sounds like they might be more involved. I don't think that they would add, more responsibilities to us. If anything, they might maybe take a little bit away with SIS assessments and stuff. They had all kind of talked about what they're going to do with those. So I don't think our job responsibilities would change a whole lot.
Yeah, I found it. Nothing in this agreement shall interpret, permit interference by health plan with communications between provider and a member regarding their medical conditions. And I think that was in the other one too. So.
Yeah, and in some, I know in one specific instance, I saw where, I don't remember which one it was going to be less restrictive with some of the services that we have now that had required a prior auth now that wouldn't come January. So that was nice to see. And they had all talked about, you know, preventative cares, and they're really concerned about that. So while they have to cover all the services Medicaid does now, I think they plan to maybe add some extra ones. I don't know how many of them will affect our clients or not, but that's just something we'll have to wait and see.
Logistically, just want to bring this up. We got two entities here who are saying we'll keep you on for 6 months. How does that correlate with the consumer's choice? I know after a certain time, they have to have a really good reason to change providers. I can see somebody getting kind of locked in here for 6 months and they say, well, I want to change because I'm losing my case manager. And they say, well, you can't because you need really good reason to do that. How does that fall in
They
place?
have 90 days to change their mind no matter what.
So,
For any reason.
Yeah.
They don't have to
After
give
the
it.
initial period though, right?
Yeah.
And then
So-
after that, there's gotta have,
After that, then you have
Just
to have
cause.
good cause until
Yeah.
their
Yeah.
yearly enrollment period.
so the good cause is going to be needed after 6 months if they're at the end
After
of the
90
after 90
days.
days, yeah.
After 90 days.
Well,
yeah.
excuse me.
Correct, yeah.
What I meant to say is after the end of the 6 months, then they'll
Oh.
have to have good cause or they can't change.
Right, correct, yeah.
So
And I would
what I'm
like-
saying is they don't change after 90 days because they still have you. And then at 6 months, they say, well, we're using our own case manager. And they go, whoa, I want to change, but they need good cause.
Right, and
So that's just a little concern I
yeah,
have.
well, any
about-
clients that we have that we know are switching, we would be helping prepare them anyway, so they would be informed, you know, right away, because that's what we did when we had to switch clients to the IHHs. We were letting them know right away because, I mean, with change, it's a lot better to work with our clients and keep them informed and help them slowly along the process. So we would inform them right away that we were going to help them transition to the new company and a new case manager.
They need to know somehow that after 6 months, you're not going to be their case manager anymore if they stay with one of these two companies.
Mhm.
They need to know that.
Yeah, and we would probably just follow the same procedure, like I said, with the IHHs, where we let them know right away and tried to prepare them. And then if they're like, whoa, didn't realize that, then they could always make a switch if
Did
they
that
wanted.
go well the last time when you do that?
On our end, it did.
What do you mean?
There were some hiccups, but.
What do you mean the last
we
time
worked
you
through
did
them.
that? Gene?
Well,
The
I mean, when you
IHH.
The
I-
IHH.
Oh,
That was I guess it was a completely new thing. And so it did have some hiccups with them getting it implemented and that type of thing. But on our end, you know, we did everything we needed to do and had the clients prepared and everything and informed them. So it would probably be much the same thing.
Neil, with your question that you asked, our intention would be, you know, as soon as the managed care company, as soon as our members choose who they want, if they happen to choose one of the ones that we don't have a contract with, then we would start talking about the discharge planning right away.
all right.
And that's how we would address it.
Good, good. Okay. I'm on board with that.
So one of the last times we presented, you guys had approved the contract for AmeriHealth pending the provider manual, and now that's ready to go. We don't have any questions on it. If you guys don't have any questions on it, is that okay then that we sign the contract for that one for AmeriHealth?
The county attorney had already reviewed
Yeah,
it.
he had
County
reviewed
attorney
it. We had
looked at it.
discussed that a month or so ago, and we were just waiting on the provider manual.
I have no problem with signing that as long as John's reviewed it and everything's
Yep.
kosher there.
yeah, we had a question about just process-wise, how we passed the motion.
Mhm.
The motion was subject to the approval of the provider manual, which
Right.
you know, I don't know, do you think it takes a whole nother motion to approve that? I mean,
I think, did it say approve or did it say receipt of? I can't remember how it was worded. I know there was two things, it was rates and,
Well, we changed that
Rates
one,
and
one
Neil.
paragraph. to
I
say-
thought that the motion was made that day and to move on, but I think Neil kind of had a little bit of a question, thinking we still needed to approve the provider.
Yeah, I thought I made a copy of that.
And we
but-
did, I mean, since you guys have approved it, we changed the rate that's in the contract too. So, I mean, it is slightly changed back to our current rate, whereas we had it at rate that would include the whole cost.
cost.
Which was a slightly,
It'd probably be best just to
Higher.
redo it then.
Redo it and then put in the amended rate with the amended rate. Cover our basis.
Probably so.
Yeah, it was interesting the way that it got stated in the minutes. It was subject to some interpretation. And
We changed
maybe
that
I'm a
one
little
time.
bit of stickler on minutes because it's our official record, you know, and I thought I copied that.
do you want me to go get the minutes? I can go get a
I
copy.
can't find them here now.
What will that amended rate be then?
44.38.
Per 15 minutes?
Yep.
44.38. Well, didn't we also have in there about that one paragraph they should drop because it stated in there as per Iowa, as per Iowa code?
Yes.
Yeah.
that was-
Which they did.
We changed that and they were okay with that.
Yeah.
Yeah, they responded that they,
John made that recommendation.
I mean, that was the only changes that we had in there, right?
Mhm.
yeah, my filing system fails to retrieve that right now.
Can't have it all here, Neil.
I just can't carry it all with us all the time, so
I've
I
got
know
a
where
whole
mine's at.
room dedicated it.
While she's getting that, do we want to talk about the well care contract and credentialing? The credentialing actually requires a spot to have an authorized person sign on that as well, which the AmeriHealth, I don't believe, did. Is that something that you guys want to? It'd be good if even if we're not gonna do the contract now, to at least get the credentialing in.
Definitely.
That's what we did last time.
Yeah.
I would
Right,
say
and
we-
once again, it would be the chair.
Yeah,
you know.
I would say we'd do that.
The one thing that is different on this is,
Because you have no problem doing it eventually.
no, except, on this one, it just has a little bit about a release and hold harmless on here that we have to sign off on. I don't know if you guys were able to get that and review it. But it says, by applying for provider participation, the following conditions are accepted as legally binding. These conditions shall remain in effect for the duration of any term of provider participation. To the extent permitted by law, applicant shall release and hold harmless from liability the company, its authorized representatives, and any third parties as defined below for any actions, recommendations, reports, statements, communications, or disclosures that are made, taken, or received in good faith by the company or its authorized representatives relating to the following: A, applications for participation; B, periodic reappraisals undertaken for renewal thereof. And then it has a place for a signature. Authorization is given to the company and its authorized representatives to consult with any third party who may have information bearing on services as a provider. So that was on the credentialing. Otherwise, the rest of it is just standard, put your stuff in, put your information in.
And again, that was on the credentialing
Yeah,
side of
that was
that.
on the credentialing side of it.
The group you did before this, did that have that language in there?
Not in the credentialing, no.
The way that sounds, I'm not sure we should have John look at that before we do it.
Is that the contract that you sent to John that he just hadn't had time to review yet?
That was the contract, yes.
Why don't you draw his attention to that
To that
line
too, okay.
as he's, yeah. And then when he gets back with us, he gets back with us.
Okay. And then we'll just present again on,
I think so.
Yeah.
Yeah, being said, I think we better have him look at that language.
Then when we come back, we'll just present on United and WellCare then.
Yeah.
Because we'll send John the,
well, we might want to do United next week, just at least to get it out there, because we might not
Keep
have
the
it
ball
by then.
moving.
okay.
Hold harmless clauses are becoming ever a bit more common in just about everything today, so I don't suspect that to be much of an issue.
And I'm not too concerned about the credentialing. It doesn't give them anything if you haven't signed the contract yet.
Right.
But I agree, have John look at it. But that's where I am. I said, so what if you give everything credentialing and don't sign the contract? You're done.
Right.
Yeah. Yeah.
I had to do a screenshot, it wouldn't let me print that, so it's right there.
Okay, I'll just read here. Case Management Supervisor Justin Schieffer met with the board for a continued discussion of the service agreements with Amera Health, Caritas, Iowa. The board discussed county attorney recommendations and the fee schedule. Following discussion, motion by Beard, Mort, and second by Bach to authorize board chair to sign the agreement with Amera Health, Caritas, contingent upon the following: receipt and approval of the provider manual. Section 5.3, strike and replace with per state of Iowa code, and with a fee of $52.81 per 15-minute unit. We'll call over it yes. Okay, and
Just have to amend the rate.
yeah. So we had a rate. It was contingent upon a specific rate, $52.81 per unit.
And it'd be $44.38.
Okay, so anyhow, this motion is not valid because of that change, I guess, so we'll have to redo it. I don't see a problem with that. And we have that 5.3, they did agree to strike and replace with per Iowa code. That was good of them. Anything else you're reading there?
No.
You guys want to read
No.
this?
So we want to go ahead and make.
Well, the
motion,
the rates changed.
Yeah, just amend the rate.
Yeah.
Well, you just will make.
Said, when it says, subject to the receipt and approval of the provider manual, we have, we should probably note that we approved the provider manual. We've received it. We've never documented that we've approved it. So I think the motion should say that we have received and approved the provider manual and wish to change
Amend the rate.
amend the rate to $44.38 from $52.81.
So is that your motion?
I will make that motion.
I will second that.
Okay. Got a motion and a second on the floor to approve the receival of the provider manual and amend the rate to $44.38. Any other discussion?
And it should be, and I authorize you to sign it.
Okay.
Should be part of that.
Pardon me?
Authorize him to
Chairman
sign it.
Yes, yes.
Okay.
I'll include that in the motion previously stated.
Okay. Any other discussion? If there is none, we'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries.
do you want to do that now, or do you want to stop by the office?
I can do it now.
Okay. There's a spot to sign, and then there's a spot on the bottom to initial, and that's just, the spot on the bottom is saying that group payment is not applicable to us because it's group physician, so it has nothing to do with us, but you still have to initial that it's not applicable. So that's on the bottom, and then your signature is right on the top. And then we'll get this in today, and then we will be completed with everything that we have to do for Amera Health.
One down, 3 to go.
Yep. And I will get the United application to John today, so that he'll have a couple weeks then to get that one looked at as well.
And then you'll draw his attention to that credentialing,
Yes.
hold harmless.
Yep. Thank you very much. Any other questions on anything?
See you this afternoon.
Yes. Yep.
I will too then.
You hear a lot of this again.
We'll see you again next Monday.
Yeah, we'll see you guys again.
But
next
don't
Monday.
ask us to present.
Yeah. Thank you.
Thanks, Justin.
Thank you, guys.
That's 4 o'clock today. We moved the time.
Yeah, 4 o'clock. Try to get some more clients and providers able to be
Yeah.
involved.
Thank you.
Yep, thank you
Yeah.
too.
Justin.
Okay, with that, we'll go down to our next, third item on the agenda, is to approve plats. We have 2 of them in your packet today. The one is in Wheatland, section 21, and the other one is in Washington, 29. One in Wheatland, 21 is basically an easement for a well, and then the other one in 29 is a small plat, and we did a site review on that here a while back.
Well, it's also, doesn't it also include that lot 1,
Yeah,
that Wheatland one?
yep.
Yeah. I'll make a motion to approve. I reviewed them on.
I'll second that motion.
Okay, got a motion and a second to approve the plats. Any other discussion? If there is none, we'll call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries. Okay, with that, the 4th item on the agenda today are the manure management annual updates. We have 6 of them here today. First one is Brian Schrader in section 1 of Arcadia Township. There's no changes there. Second one is Matt Helber in section 25 of Iowa Township, Crawford County. There's no changes on that one. The third one is Kennebec Farms, section 13 of Roselle Township. That one they have updated the soils and P index. The 4th one is D&D Clucky, section 22 of Eden Township. And that one they are using a manure analysis. The 5th one is Wayne Reesburg, section 21 of Roselle Township. That one they have changed crop rotation and they're using a manure analysis. And the last one is Double D Pork, section 34 and 35 of Eden Township, and there's no changes there. So that's packet. Manure management plans for today. Courtney. With that, we'll go down to committee reports. You want to start off, Neil?
Sure, I'd be glad to. Starting out with Tuesday, and Gene can help me with this one, it happened to be with the RDG, and from RDG had met with the housing committee, and I won't go over everything. I'm sure Gene may have things to add. Just some points I highlighted that I'd like to bring to the board's attention because they're either interesting or important. First of all, we talked about the labor shortage, and I know Gene had brought a map to our last meeting showing where Carroll County had a 2.4% in unemployment rate, and there's only 3 counties in the state that are less, which is Lyon, Sioux, and Story. And the big thing, like Gene said, is you look at the map, there's one blue county. That's the only county in Iowa that has had increased unemployment. I don't know why it's Cherokee County, but everybody else's unemployment is decreasing.
Shrinking.
In fact, a year ago it was 4.3% statewide, and now it's 3.6. Carroll's at 2.4. And it brings up some thought, why is this? Well, we have jobs people work at, whether they be unemployed. We have people that'll work, good work etiquette, or maybe we need more people. That was another thought of it. So, versus how many jobs are available in these different areas too. So, but that was just kind of a side shoot of this. But one thing that was brought up, the reason I mention this, is that the labor shortage is widespread, and we realize that on the housing committee. It's not like Carroll County has a unique issue. It's widespread. A statistic that surprised me is they take a survey on vacancy rates, and 2000, 2010, 2013 in Carroll, area, it was 8.1%, which is a bit high, which kind of is different than what we were expecting because of the housing. But the vacancy rate was a little bit high, and of course, the next question is, well, what kind of housing is vacant? And we don't have statistics on that. My understanding is they had 1,400 total survey. Someone said that sounds high. Did I get that figure right, Gene?
Well, it's, yeah.
I had
14
517 on the regular side and 792 on the employee side at that time. And
I had 560 on the housing and 792 on the employment one. And they were, Amy's very happy with those numbers. I mean, she thought they were good numbers. The group themselves was kind of disappointed. We have a lot of industry that we could not do the employment in there because of their non-solicitation
Status.
Right.
Programs they have in the workplace that let them put them out. So we have some of them, and the only way we don't know how many of them we've gotten through social media, and there's through the media, the radio, and social media that maybe have decided to just go ahead and do it. So we don't know what that number is, but.
Okay, all right. I'll continue, and Gene may have more to add as well.
Go ahead.
I appreciate that. It's a big group report. Some other things is just looking at the logistics and the people. They estimate they'll need 37 independent retirement homes for people who are living in big houses or houses now that'll want to go to an apartment or a condo or something like that. And that also coincided or correlated with one of the questions they asked. If you're 55 and older, there's 50% of the people who are 55 and older said they will be moving. They plan to change housing. So that kind of correlated with that. And then the question was, if you want to change the housing, what are you looking for? Number one was large single-family homes. Second was smaller single-family homes. And the third biggest request was like a duplex condo or apartment. So that was a townhouse. And 71% of the people were able to find what they wanted when they came here for housing, which I thought was a little high too. But do you have anything to add to that? That's
No,
part of your
that,
committee report.
Basically, just like you said there, you know, and those statistics will probably change yet. They were gonna keep those surveys open yet until the end of this last week. So there'll be some paper documents they gotta enter into there yet, stuff like that. And then with that, they'll start correlating everything to come together and come up with what they think's gonna happen.
And November 27th, we're gonna have another
Yeah.
kind of wrap-up meeting. Is that right? Is that the right date?
I don't have that wrote down here. I think it's sometime.
Okay. All right. Then I'll move on to Wednesday. In Sac City, we had our monthly Rolling Hills meeting, and a person by the name of Robert Schindel was there. He has got a company that works with HIPAA, and he gave us all kinds of reasons why we need to have a HIPAA policy. It's a very good HIPAA policy. He gave all kinds of examples of places who had made a mistake on HIPAA and got sued for a lot of money, and he wants $16,000 to $19,000 to do this. So we're looking into having someone else do it maybe, and that's to get it done, and to maintain it in future years would be about 70% of that amount. So everything sounded good but the price tag. And so we did not take any action on that, but I know when Dan Neal was on here, he kept saying, Neil, you need to keep track of all the extra costs, like we have to have an additional liability insurance, even though every entity there has liability insurance, so that's an extra part. Well, this is another one of those things that really
Extra cost.
bothered him, where it's an extra level and an extra cost for the same people doing the same thing. Okay. I also reported last month where we had a request for payment from the Spencer Hospital, and they should not have had that expense had they properly filled out their admittance forms. That would have been covered, but they failed to do that, so they fell back on us and wanted us to pay that. We got some legal advice from Roger Saylor, who's the Crawford County attorney who helps the board out, and he says you're under no obligation to pay that. And of course, we could have if we wanted to, but we denied it, partly because it was for fairly significant amount. And secondly, we didn't want to set a precedent like we're going to be the catch-all for you if you make a mistake. Patrick was there from Plains and give us some updates on the crisis stabilization. And they're doing some remodeling, 2 or 3 weeks to finish off the deck, and they're doing some painting and stuff. And now they're planning an open on January 1st. And I go, how confident are you in January 1st? When you started it, it was going to be open by November 1st. And you said, well, even last meeting, he said November 1st or maybe December 1st, and now it's January 1st. And their biggest concern at that time was getting people hired, and they're just finishing writing up the job descriptions. They haven't had their first job interview, so they're not even sure they don't have anybody hired yet. But like everything else, he thinks that will go well. But it's been backed up the 3rd month in a row. And the reason I make a point out of this is because there were some other entities, one of them here in Carroll County, who was very interested in doing the same thing, but felt they couldn't meet the timeline of getting open and stuff, so they didn't. There was 2 entities that didn't apply because of that. Patrick said he could, and he's not. So that's the part that bothers me. Okay, you get the point. Okay, if you don't, I'll give you. If you don't get the point, I'll talk to you after me.
Deja vu.
Yeah, deja vu. Good description there. Also, on this house that they bought, we
Fool me once.
are going to have. Okay. I got my point across, I feel that.
Well,
I feel good about
You
that.
reminded me of a meeting we had for one evening, that's what you reminded me of.
Yeah.
Done once and did it twice.
Okay. In regards to this house, which is the crisis stabilization house, they have agreed in principle to sign the deed over to us because the issue is, well, they have the deed to the house and we bought it through a block grant, and if something goes south, we should get the house back. And they're working on that, and their attorney needs to look it over, and hopefully that all goes through. I had brought to the attention of this board that the top legislative, one of the three top legislative priorities for ISAC had to do with the payment situation where counties would get frozen at their previous 1996 level, which means that Buena Vista County would not be paying $43.87. They'd fall back to their old 20. And on down the line, there'd be about 3 counties in our region who would never pay more, and that should get changed. We visited about that, and we are going to have our current legislatures come, and we're setting to visit with us, or we're going to visit with them on December 10th. So we're going to have a regular meeting on December 10th, and we're going to invite all the legislatures who are in the region. And our board is solid on requesting that get changed, and it should. A lot of routine business that would not be of interest, but those were things that were of interest. Any questions on Rolling Hills? Okay, and then Thursday we had the county roundtable, and we were all there, so I'm not going to say too much. The only thing I'm going to say is at the meeting I mentioned where we were looking at this captive thing, I got quite a few people after the meeting that said, hey, if you get that thing going, I'd be interested in it. So I'll just leave it at that because you were all at the meeting, and I'd just be repeating what you heard there. And but in regard to that, with group services, I had sent them a whole list of questions, and Dean was on board with that. He reviewed them as well. I have gotten response, basically, thanks for your questions, Neil. We want to acknowledge receipt of them, and we are getting together a response for you. So I'm waiting for the response for that, so they have received them. I'd also mentioned where I'd asked Carl to put this Directive of Human Services as a link on our website as requested at a previous meeting. He did get that done and did a great job, and I thanked him for it. So I want to follow up that was done. And those were my meetings for the week. Any questions? Okay.
Thanks, Neil.
I hope I made your report easy here, Gene.
Oh, no, I got still some more stuff, yeah.
Okay.
back to that housing study, one of the things I thought was kind of strange, a lot of people didn't realize that what the population that we did have increased, that like Manning and Coon Rapids increased, and weren't aware of that. There were certain communities that did increase, which were basically in the southwest part of the county. So that was one thing I thought, that a lot of people weren't aware of that, but I was aware of it. Okay, and then on Tuesday night, I had a policy council meeting. We had our meeting, and we went through the financial reports. They're in really good shape there right now. They're with the year at 83%. Their expended dollars is at 76, and their non-federal is at 82, which is the in-kind stuff. So that's all good there. We had no health and safety issues. We went through the program report. We did have, we were short some kiddos, and you gotta remember, this is the beginning of the year again, but we were at 239 at this point on the end of September, and we're funded for 247, but we have 30 days to fill those slots, and those slots have been filled since then. And early Head Start, we was at 35, and we're supposed to have 36 is what we're funded for, and those are also been. The other thing that was kind of interest, they do this disabilities things, and we're supposed to have 24 that were required in Head Start. Currently, we're at 19, and early Head Start we're required for 4, and we're at 3. This is typical for every year because this is the beginning of the year. As they go through the year, they pick out these disabilities as kids go through the school year, and then they move them into this situation. So that actually not bad numbers at all. The other thing is our early Head Start, the attendances, the total number of home visits was 130, which is out of a possible 138, so they was very good there. The rest is all community hours and stuff like that. We had no abuses reported, so we had the only thing we had on committee reports is that this was our meeting that beginning of the school year, where it was an organizational meeting, so we had a lot of new people in attendance at this thing, and we didn't have any committee reports, but they were all given an opportunity to sign up for different committees, and these are like assessment and then employment deals and like that to help out throughout the year, so they had an opportunity to sign up for that. We did get our last school district partnership and food service agreement back, and that was Audubon County. Other than that, it was basically went through the policy handbook for the new members, and they all had the opportunity to sign the code of ethics and code of conduct and nepotism and all that good stuff. And then finally had the election of officers, and they elected Ashley Lynch as president and Nikki Cleary as vice president and Kirshen Cassidy as secretary. And then we did have some staff updates. They had some new staff at Carroll and Perry, and did have a resignation at Perry also. So that was policy council. Then on Thursday, had a new opportunities board meeting. Was kind of a routine meeting there. We did have recognition of 2 retirements that we had. Helen Reese of 23 years and Marlon Jennings for 43 years. They were retiring. And then we went through the financials there and accept those. And then the last thing we did do is we had the new budget, and I can't find it. We did approve that budget, and that was a $10.2 million budget for this next coming year. Went through all the Head Start data with the board again, and that was about it. Oh, we did raise we did go through our insurance last month, and we did raise our data compromise limit. We currently had 50,000. We did raise that to 100,000, and that costs us only an additional $122. And that is in case someone breaks into our system and gets like her information, that when we get sued, we can get covered on that, or to help reclaim that. So that's what that's for. And then we had some training for the board after that, and that was about it. And then also was at the county roundtable meetings, so that was my week.
Thanks, Steve.
Oh, here, I found that button. Right here.
I had no official business last week, but I want to thank Neil and Marty for their input at the roundtable meeting on Thursday night. Thank you for that.
Welcome. Thank you. Mark?
Well, that was my only committee report too. It's been well hashed. One thing that I will point out is we were the only governmental entity there in force, and so I'm very proud to serve with this board. All 5 of us were there. We don't miss much, and I think that that's very exemplary to serve with you guys. I understand there's always conflicts and schedules and things going on, but we really don't miss much. And there really weren't very many mayors there, which really kind of surprised me. And I realize Glidden's probably about as far east as you can get, but it makes it a little bit more of a drive. But Harvey was there, so and he had the furthest to drive. So it's just a pleasure to serve with all of you. And again, I hope they continue. And I think it was still a good meeting. One question I'd ask you guys is, were we asked that night to fund the football stadium? Did anybody catch any of that?
It's coming.
Did anybody,
Yeah, it was.
did that go over everybody's head, or was that?
No, that was very, yeah, that was the sales pitch.
Yeah, we all got to work together. Is that what
Yeah.
liberals
Yeah.
call
That was it.
working together? I thought that it was the first volley. So
Yeah, that's exactly what I'd say. I think
Okay.
they was kind of leaning towards that.
so.
I would argue, you said leaning, I would say pushing.
Pushing? Well, I stand corrected then.
Well, whatever. Yeah, you're right. It was going that
Wrong
direction,
suggestion.
one way or the other.
Well, I want to be an elected
Hey.
official that's considered to be a good listener, but I think I just shut my ears off. But anyways, you know how I feel about it. You know, what we did with the baseball stadium a couple weeks back, I mean, it was $2,500 is rather minimal in terms of what I believe could be a true economic impact, you know, to Carroll County. And I didn't have much heartache over that one. And again, we're leveraging more dollars to do that. But where this is a, you know, something that's owned, something that we have no governance affiliation with, you know, in terms of a school board, rather than a municipality, I think it's a vast difference. But they're going to get these elections taken care of tomorrow, and again, that's a city election, but I still am amazed at how often the stadium came up in these city elections. Like, that's a city issue, so.
And it's not.
It's not, but again, let's remember that it's not a county issue either, because it's going to come. So I hope we can remain congruent about that. So anyways, proud to serve with all of you, but I thought the first volley was offered up. I didn't know if you guys caught that or not.
Yeah.
And that was my week.
I guess mine, I had the Glidden City County Roundtable. I mean, I thought it's well attended. You know, it's kind of interesting because we made some calls to try and get some of the other smaller towns there, and it didn't pay out. But hopefully in time it'll maintain. I think they're good meetings. I mean, you learn on what's going on in all the other small towns around, and it's always good to hear those things and what they put forth.
And I think actually some of them smaller communities that aren't there would gain a lot from it.
Oh, I think so too.
If you did get
Yeah.
the most bang out of it.
Yeah. But, you know, you can only lead a horse to water again.
Yeah.
And drink.
I made the one call and I got,
Yeah, I made 2 calls still, so got nowhere, but we'll keep trying.
You're going to run out of hosts if they don't get somebody else to
Yeah.
show up.
So hopefully it'll play out as time goes on.
Hosting
And,
is
you know,
easy, you don't have to travel.
Yeah. I mean, everybody's schedule is busy, but, you know, you get out of
and there's
something.
gonna be a
quicker.
time when we're gonna have to probably do that too, also,
Yeah,
so.
yeah, sure.
Well, that's no problem.
Yeah.
So that's all I have. So,
Yeah, that's a good point, Gene.
Yeah. Any comments from those in attendance?
I do have a question before we close. You know, we talked last week about the assessors' rate raises, and It's come to my understanding via another conference board member that he is dropping his request. But
That's what I understand.
we didn't receive a letter on that, and apparently there was 2 letters that went out to conference board, and I never received one. Did any of you receive? And I'll
No.
ask why we're not
He's
receiving
dropping
those
his
letters.
request.
Dropping the request for now.
For now.
Oh, really?
Mhm. But again, I had to find out from another conference member. I didn't hear, I didn't get a letter.
I haven't seen anything.
Well, Marty should have at least gotten one.
I would have
mean,
thought.
Did you get any, Marty, did you get any calls or anything on that?
No, I haven't so far. So, no, haven't.
I called, several members of the. because it-
I talked to one, and he was gonna call you after he received the letter.
I haven't done anything.
Courtney, previous meeting, 2 meetings ago, I gave you a form from Group Services, and you had a concern about that due to HIPAA regulations.
Mhm.
Because we have more than 50 members and we're giving general information, it's not a concern with HIPAA. That's my understanding. Do you still have that form?
I still have the form.
Yeah, why don't you go ahead and send that in then?
Okay.
Because I shared your concern, but if you have fewer than 50 members, then your HIPAA requirement goes up because people can read those forms and we're okay on that.
Okay.
So go ahead
I was
and do
gonna
that.
ask you about that too.
Yeah,
so, okay.
appreciate that. I meant to talk to you about it before the meeting, but
Not to belabor it, but we should have all gotten letters. We're all members of the conference.
Well, I
board,
kinda
not
thought
just
that,
the
too.
chairman.
Yeah.
Absolutely. He's the
Official
chairman, but we
letters.
are all members of the conference board.
You got a letter?
No, I
No.
haven't. yet.
Really?
And maybe he hasn't sent them out.
No, it's dated October 30th was the copy that I saw. I had another conference board share it with me yesterday.
I was up here Friday, and he kinda asked, because he said something to me about it. And so he hadn't had it sent out then yet, Friday when I was up here.
One conference board member is in receipt of it. I'll leave it at that.
Hmm.
Anything else?
Do you have anything?
I will move to adjourn the meeting.
Second.
Got a motion and a second. Any other discussion? Now, call for the vote. All in favor, say aye.
Aye.
All opposed, same sign. Motion carries.